Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs through my concierge medicine program, virtual medicine program, through my national speaking, and with my brand new best-selling book, Vitality. Good afternoon, ladies and gentlemen. Welcome to Let's Chat. I thought that we'd come on today to talk about vitamin D. We talked last time and we said we'd go into a little more detail about vitamin D, giving you a few tips to have a safe, happy holiday, and we wanted to make sure that we addressed the concerns about the issue with the COVID-19 parties that we've heard that have been going on. So first, let's talk about vitamin D. So there are several studies that have been done comparing vitamin D or looking at vitamin D in patients that are positive with COVID-19. The study that I'm going to highlight with you guys today is a study that was done by Northwestern University during the month of May. They looked at 10 different countries, including the United Kingdom, the United States, France, China, Italy, 10 different countries, and they looked at patients that were positive with COVID-19. And what they discovered is that there's a correlation between having a low vitamin D level and having a hyperactive immune system. So let's go into that a little bit. So naturally, vitamin D helps us to strengthen our natural immunity, or the natural process by which our bodies help to build antibodies to help fight off viruses, bacteria, etc. So naturally, vitamin D does that. It also prevents you from having an overactive immune response. Patients from countries that had high mortality rates, when they looked at this study, discovered to have low vitamin D levels. So if your immune system is hyperactive or overactive, it can cause you to have a hyperinflammatory condition that can severely damage your lungs. So if you have this overactive immune system, or this hyperinflammatory condition, we call it a cytokine storm. That's the medical term for it. But it's basically a hyperinflammatory condition. It can cause you to have severely damaged lungs. Now, having severely damaged lungs from having a low vitamin D level creates an environment where COVID-19 can proliferate. So that is part of the reason why paying careful attention and making sure you have adequate vitamin D is something that will help to decrease the complications, including death, of COVID-19. So number one, vitamin D enhances our natural immunity. Number two, it prevents our immune systems from being dangerously overactive. So what does that mean? That means having healthy levels of vitamin D can actually protect against severe complications of COVID-19, including death. So it won't prevent COVID-19. We're definitely not suggesting that, but making sure you have adequate levels can make a difference in what complications, if any, you could experience. So the reason why that is important is that vitamin D is key to help protect some vulnerable populations. Number one, there are two different groups that tend to have larger percentages of people that have a low vitamin D level. Number one is elderly people, okay? And the second is African Americans. They have a high prevalence of having low vitamin D. So in an effort to decrease complications of COVID-19, making sure you have an adequate vitamin D level, and with that, you just need to contact your physician. This is a blood test that is routinely run. If you're someone that's out there and you have a history of low vitamin D, definitely make sure you're taking your maintenance medicine. If you're supposed to be on an over-the-counter dose and you've been recommended to be on that dose by your physician, please make sure that you're taking that. You know that our bodies naturally produce vitamin D. We've talked about that before by us being out in the sunlight. As African Americans, we have darker toned skin, so sometimes the melanin there makes a difference in the amount of vitamin D that you can produce with the amount of exposure that we have in the sunlight. So that is the correlation there. So we want to make sure that we have adequate vitamin D levels, so see your physician about that. So second thing we're going to address is there are COVID-19 parties in Tuscaloosa, suspected COVID-19 parties in Tuscaloosa by some of the students there. The law enforcement fire chief have confirmed that with local physicians. And so what happened, just in case there's anyone listening who didn't see the story, a COVID positive patient went to a party and they called some of their friends to come to this party. They paid at the party to enter the party, and they have a cash pot, and whoever gets COVID-19 after this party gets the pot of money. So first of all, that is severely disrespectful to the frontline workers and healthcare workers that are putting their lives on the line every day to try and help keep all of us safe. So that is not a good idea. It's not something that is going to turn out to be a good situation for a lot of people. I'm happy to hear that the officials passed an ordinance requiring a face mask in public, and I definitely recommend, if you live in the city of Tuscaloosa, I would not go anywhere without a face mask on. In fact, it may be time for you guys to quarantine down a little bit heavier, even if you're free to go out to, restaurants, bars, other places. I would do that with so much caution, knowing that a higher amount of COVID could be in that environment. This is what we mean when we talk about their hotspot areas, so Tuscaloosa would be somewhere that we would be concerned about being a hotspot area. Now, Dr. Celeste is not saying, oh, Tuscaloosa is a hotspot, but because of that behavior, we have to be concerned about that. So the two things that we want to make sure coming out of that situation, or make sure we have knowledge of, is making sure that you don't interact with anyone who attended one of those parties. First of all, if you have interacted with them, you need to be tested as soon as possible. Quarantine yourself and be tested as soon as possible. And then secondly, there's a concern of the parents and grandparents of the children who attended all of these parties, because while the children may be okay, and just to hit back on vitamin D a little bit, one of the reasons the vitamin D levels provide a level of protectivity, or talking about vitamin D and why is it that children don't seem to be as affected as much by COVID-19, is because children don't have well-developed immune systems. So that hyperactive response that we referred to a little bit earlier, they would not be someone to be likely to have that kind of a reaction. And that is why we're not seeing as many cases of COVID-19 in children. We definitely are seeing some cases, but just not as much. So again, the concern may not be for the kids that attended those parties, but the parents and grandparents and relatives of the children that attended those parties definitely need to be on high alert and stay away from these individuals, as most of the time parents and grandparents may have other health conditions, especially if you have any chronic health conditions like asthma, heart disease, diabetes. You want to be careful in interacting at all with any of these people. I encourage you to stay away from them, especially if they haven't been tested, to make sure that they're negative. So we're going to end it today with just sharing with you 6 tips. We posted something a little bit earlier, just trying to reiterate the same things, guys, that we've been talking about over the last several months. 6 tips. Now, the first thing is that we all know we're safest at home. I would be selective about who I interacted with, because the fewer people you interact with, the less risk for COVID-19. So I would definitely make sure I would go through a mental process with that before you decide to interact, socialize with other people. So that's the first thing. Secondly, if you decide to socialize with someone outside of your home, it's best for you to try and find a social activity you can do outside. That's the best thing. If you do venture into someone's home, I definitely would encourage you to let the windows up to make sure we increase the ventilation and that respiratory droplets aren't just sitting in a compacted space. And again, you're safer outside and safest at home. Third, I would avoid any crowded beaches, pools, or bars. The thing about bars is this, and this is why COVID-19 loves bars and proliferates, is because when you're in a bar, most of the time, there's a lot of pouring of drinks. There is a lot of noise because there's music playing. So what happens when the music is up and you can't hear? People yell and talk more, right? Releasing more respiratory droplets and spitting out everywhere. So it's just proliferating all in the environment. In addition to that, when people drink, if you have a few drinks, if you put a few on, a lot of times people will relax their standard and get less cautious about your behavior and interacting with other people and keeping that 6 feet distance. Fourth tip, make sure you wash your hands before you eat. This part is really important because we touch door handles, doorknobs, things like that. So you want to make sure that you wash your hands before you eat. So you're not, if you have a hand that has touched something that could have something on it, an antigen or a piece of particle of virus on it, that you don't enter that into your mouth. Obviously, we want you to wash your hands frequently because that is one of the things that COVID-19 doesn't like. It doesn't like you to wash your hands. So we definitely want to do that. So wash your hands frequently, but definitely before you eat, follow our mom's advice from old years ago. Wash your hands before you eat. Fifth, watch the fireworks from your car instead of getting out and socializing. That will help to decrease the risk of spread. And sixth, what I've termed the triple threat against COVID-19. COVID-19 does not like you to wear a mask. It doesn't like you to social distance for 6 feet, and it doesn't like you to wash your hands. So those are the 6 tips, ladies and gentlemen, I encourage you to follow to help hopefully keep you guys safe for this weekend. I'm going to go through and see if we have any questions. Thank you all so much for hopping on. Happy 4th, everyone. Let's see. Okay, I don't think anyone has any questions today. I hope everyone has a happy 4th of July. Please stay safe and be mindful of your environment. And again, if you live in Tuscaloosa, I would exercise the most extreme form of caution in interacting, socializing, or even leaving my home. And I think someone has one question. Let's see if it's going to come through. Thank you guys for taking time out of your schedule to join us. Okay, Miss Philia, I think Jamila has a question. It's not coming through though yet. Okay, the vitamin D information. So we talked about vitamin D, and the 2 things about vitamin D that we know that it does is it helps our bodies naturally it helps you naturally for your natural immunity. Helps your body to naturally build up your immunity. We know that. Number 2, it helps to prevent your immune system from having what we call a hyperactive inflammatory response. The medical term for that is a cytokine storm. Basically what that means is when you have a hyperactive immune system, sometimes that can cause damage to your lungs or the lower air passageways, creating an environment making it easier for COVID-19 to cause you to have complications. So having adequate vitamin D is something that's very important. There are 2 populations that have higher percentages of vitamin D, and that's the vulnerable population of the elderly and African Americans. So you want to make sure that you check in with your physician. If you're out there and you've ever been told that you have vitamin D deficiency, please check in with your physician. We know that if you have vitamin D deficiency, you run increased risk of having fractures. If you fall, it makes it very easy, even if you're young. I had a hip fracture at I think I was 40 when I had a hip fracture after falling in the snow and ice, and it was because my vitamin D level was a little bit low. So as African Americans, we tend to have a low vitamin D more than other cultures. So you just want to make sure that you have adequate vitamin D intake and that your level is adequate so that you can decrease the likelihood of having complications from COVID-19. It cannot prevent you from getting COVID-19, but it can help to prevent you from getting complications. So that's all we have to share with you guys today. I hope you guys have a happy 4th. Keep in mind our 6 tips, and we'll see you on Sunday. So excited. We have a guest. Dr. Mia is coming to join us. She's our B3 specialist, and she's going to be sharing with us, ladies. And it's not just for ladies, guys. You can join us as well. But she's going to be talking about keeping the V flower healthy. So this is not a kid-friendly topic we're going to have on Sunday, guys. Okay. So we'll see you guys on Sunday. Everyone be blessed, be safe, and mask up. And remember that 6 feet. Have a good day. Bye-bye.